Welcome to Chalkwalks. With this case, I'd like to discuss the management of acute respiratory distress in a cat. Our patient is a 7-year-old domestic short-hair cat, male castrated, 8 kilograms, and has had 24 hours of respiratory distress. The referring veterinarian had taken radiographs and felt like it had a snowstorm appearance, and what this generally suggests are things like neoplasia, fungal disease, or possibly lower airway disease such as asthma. And so, and the other possibility in addition to this is congestive heart failure. So with all these differentials on the list, of course, the cat is extremely stressed. You can see that by the elevated glucose. Dehydrated, you can see that the creatinine is a little bit elevated, but they felt that was totally associated with dehydration. So what is the key to managing a cat like this? Well, absolute essential is oxygen. So if you have an opportunity to put the cat into an oxygen cage, you can do that. You can even put a cat in a fish tank with oxygen being piped into it. This will help calm the animal to reduce the tendency towards its stress due to oxygen lack. The other thing that we do here is, in this case, because of the concern over the possibility of fluid in the lower airways, is to use a loop diuretic, furosemide. This drug works in the thick ascending limb of Henle and is called what we say is not only a loop diuretic, that's what that means, as well as a high ceiling diuretic. And this means that it's very potent, and it has the effect to lead to the excretion of sodium, which is obviously important for fluid, but also other cations, potassium, calcium. Sometimes we use it clinically to treat hypercalcemia, as well as will lead to magnesium loss. So why is this particular drug as a diuretic of use to us? One, it's got a characteristic that not only will it reduce fluid throughout the body via increased excretion through the kidney, but it will also have the other effect of increasing pulmonary venous capacity, capacitance really. And what does that mean? It means that through prostacyclin, it leads to vasodilation, an increased tendency to take on fluid from the pulmonary interstitium. And so for this reason, furosemide is very specific for pulmonary edema, and we also use it in situations where we think there's any scenario that is associated with pulmonary hypertension. So we give this IV, bolus, and sometimes periodically thereafter to effect, with the hopes that this will help the animal. Now you have to maintain the hydration status. It seems a little bit counterproductive, counterintuitive to do this. You have to make sure they don't get dehydrated. You already have an animal whose creatinine is borderline elevated, and therefore you need to make sure that they have the fluids on board. But what you're doing is you're preferentially removing fluid from the pulmonary vasculature, and then it's being lost from the body. Now, the other thing we want to do is to bronchodilate. And this drug we have listed here, Albuterol, is a Beta2 agonist. And Beta2 agonists can be quite potent bronchodilators. Now, what's key about this particular administration and there's debates about how effective it can be, but is by inhalation, using it either by nebulization. This can be done, although you have to make sure that the particles in the nebulizer get to the deepest reaches of the bronchial tree. Or you can also use basically fine albuterol, like any asthmatic would take as a inhalant. So an inhaler can be used. The dosing needs to be a little more careful when using a human inhaler. But this is a beta-2 agonist, and what does a beta-2 agonist do? It leads to relaxation of bronchial smooth muscle. And that is effective in these cases. So the combination of oxygen is key, loop diuretic, and albuterol, and possibly also in some cases you'll see additional use of sedations and even opioids to reduce the anxiety over the perceived oxygen lack, which just makes an animal hyperventilate. Now that was not used in this case, but you'll occasionally see opioids used in that scenario.